So we're recording in progress. Welcome everybody to the day 2 of the ISRM Institute of Strategic Risk Management Global Urban Resilience Conference. It is a delight to have you here, to have you as part of this, to have this event. We had our first day yesterday on governance and policy. And today we're going to be looking at academia and the academic input, influence and significance. I'm delighted to say that we have 3 panelists with us. We're waiting for another panelist who hopefully will be coming. We have 3 panelists with us. We have Alistair D.B. Cook from the Rajaratnam School of International Studies in Singapore, where you are on the Humanitarian Assistance and Disaster Relief Program. And also you are, I had it here, you are for the Centre for Non-Traditional Security Studies, which I'm looking forward to hearing about very much. We have Nadine Sulkowski coming in from the University of Gloucestershire. And Nadine is the lead for the BUILD program. BUILD is Building Universities for Leadership in Disaster Resilience, which is a EU Erasmus funded program, doing great work in Indonesia. I have the full transparency here. I am actually on the board of advisors of that program, I have to say that, but it is a great program. I'm looking forward to that very much. And we have Jess Stern from the FEMA Federal Emergency Management Agency Academy, and also an adjunct professor at Georgetown University, one of the leading, I think, fair to say, one of the leading institutes, academic and policy influencing institutes in the United States strategic policy environment. Ladies and gentlemen, it is a pleasure to have you here. It's good to have everybody else coming in from all over the world. So here we go, let's start. Academia, it's an interesting thing, isn't it? I'm sure that you share my experience. I've been around for doing this in the UK for 30 years. And during the whole of that time, we have absolutely had to justify ourselves to experienced, grey-haired, grizzled practitioners. What the hell can you teach me, son? And we were trying to talk to police chiefs, to fire chiefs 30 years ago. And they said, well, have you ever stood in the river at 2 o'clock in the morning when the river's rising, we've got to get 200 people out in the next 20 minutes. Have you ever done that? I said, no, I haven't done that. And they said, in that case, you have nothing to say to me, because until you've done that, you have nothing to say. And I think that we had to, in those days, accept that challenge. We said, okay, if we're going to have validity and relevance, we can't swerve from that. We have to accept that challenge. And I think we have done that in a couple of ways. The first thing is that what I used to say literally to those experienced practitioners who were saying, well, what the hell can you teach me, son? Is I absolutely acknowledge and respect your experience. I mean, this is not decrying your experience. And if you said to me at 2 o'clock in the morning, David, move your people, move them now, move them fast, I will put my lives and their lives in your hands. And I'll say, right, we move. And if you said, don't worry about it, stay there, stay, wait for my come up, I'll say, fine, I'll stay. I will absolutely trust you. The issue is, what happens if you're not there? What happens if you're not there? What happens if you're caught in a car or on your plane or your mobile phone's turned off or you're on another job or you're caught in traffic? Then all of your skills and experience and insight count for nothing because you are not there. And the other issue is, you can't tell me why you made that decision. And if I want to be able to understand how and why you made that decision, I have to live your life. I have to build up those experiences that you have been through, because all of your capabilities are experienced and individuated, and that's what it is. Not to decry it, they are excellent, but that is what it is. The problem with both of those points is that your experience does not translate into organizational capability. That is something else. And if we're going to try and create organizational capability, we have to transition and transfer your individual experience-based capabilities into organizational capability. And from my perspective, there are 2 things which allow us to do that. The first is structure, and the second is methodology. And anybody who's heard me talk or teach or do anything knows that everything I do comes down to structure and methodology. How do we encodify that? Just like doctors have structure methodology, and engineers have structure methodology, and architects have structure methodology. And I'm sure that one of the points that we are going to be discussing is, do we have structure methodology in strategic risk and crisis management? And from my perspective, I'll put it on the table, I don't think we do. I'll make that clear, and I'll be interested to hear your points. So that is the first point. The first point is, what do we have as academics, in my part, pra-academics, to bring to the table? The second point is, how do we create professionalization in this sector? How do we create a capability that has the capability of supporting and enhancing decision-making across the range of challenges and contexts that we're operating? And I think that COVID has been a wake-up call to us all. Jeff, there's going to be certain things we say which are going to have certain might have some emotional resonance with you. I'm going to mention Hurricane Katrina. My apologies, anybody involved in FEMA, but I think Hurricane Katrina in 2005 was a wake-up call that we're probably not as good at this as we thought we were, and we really have to question about the paradigms we bring to the table. Because if we can't handle that, we can't handle COVID. What happens if we have a bad one? Because of course, COVID is not a bad one. COVID is only a mid-level pandemic. And yet, all of the frameworks and capabilities that we thought we were bringing to the table seem to have disappeared in smoke the moment they were challenged by the reality of a global event. So in terms of creating professionalization, if you look right now at the academic aspects of strategic risk and crisis management, it is almost unrecognizable from 15, 20 years ago. Nowadays, master's degree is pretty well entry level into anybody trying to create a career out of this. You're expected to have those qualifications and backgrounds and degrees, etc., etc. The question is, does that translate into capability? Does that make the world a better place? Does that make us able to advise and guide our communities and our organizations and our councils and our cities? Because they are all facing challenges which are way, way beyond their natural capabilities to deal with. So that is what I'm hoping we're going to be talking about today. Besides that, feel free to completely ignore what I've just said and to talk about something else if you wish to do so. What we'll do is we're going to have, for those of you who know how we do these things, we're going to keep to the same format. I'm hoping that Ava is going to come on at some stage. I'm not quite sure why she's not here, but hopefully she will do. I'll keep checking the emails to see if she's coming in. I'll ask you for our panelists to give a short introduction, 7-8 minutes, certainly no more than 10 minutes, about who you are, what you do, and what you think are the main themes and issues and challenges we are dealing with as a global community. So that'll take up 10 minutes each, let's say. Then we'll have an open discussion, which I'm very much looking forward to. And then for the last half hour, we will open it up to the floor for questions, and we will respond to those questions. Feel free to, those of you in the chat rooms, put your comments up. We can all see them, and we look forward to having that. And so why don't we start with you? Why don't we come over to Singapore? Southeast Asia, APAC, ASEAN has been hit hard by COVID, hasn't it? It's been hit not just by COVID, but it's been hit hard by a lot of things. It's pretty tough down there. I know it is. So tell us a bit about what you're doing down there and some of the main themes that you see emerging in the academic world.
Sure. So firstly, thanks for inviting me to this conference and the discussion. So first, a little bit about myself and what I do. I established the Humanitarian Assistance and Disaster Relief Program at the Rajaratnam School back in 2014, 2015. And since then, we've developed a core team, and we are about 4 or 5 up and down, depending, of researchers. So there, within that, we have 3 core research areas. So one is looking at the emerging landscape in the Asia Pacific. The second is what we call community protection, which is essentially vulnerability studies within the Asia Pacific. And the third area is the impact of new technologies on relief and humanitarian affairs. And where we sit within the regional community in the Asia Pacific is we're physically in Singapore. but we are very much connected to the discussions within ASEAN, which is the regional Association of Southeast Asian Nations. So we work closely both with the Secretariat, so that's basically the strategic arm of the regional organization, and then what is known as the AHA centers, the ASEAN Center for the Coordination of Humanitarian Affairs and Disaster Management, which is much more the practitioner side and focused on goods coming in, goods going out, people being deployed, and so on. So when I set up the team, one of the first things I wanted to make sure that we were doing is, as you've mentioned already, is to be a bridge between these two levels. So between the practitioner level and with strategy. And that's really where I think our academic community here fits within that. Because often we'll have practitioners who are in the river and have all the experience, hands-on experience, but then they might not be having the time to think about beyond the immediate future. So longer term strategic trends, or having a deep dive into an issue, or perhaps deconstructing why did something go the way it does. So what we did then was to ensure that the team, and myself, one of the teams started off by joining the ERAT, so that's the Emergency Response and Assessment Team training through the AHA Center. So we were part of batch 2 to see what it was that they were being taught in scenario building exercises around the region, and it helped us get to know people within the sector as well, because it's a region-wide training. And then since then, we have developed that relationship into doing more training with the senior executive level for the disaster management community in ASEAN. And that's really where I think we sit, and the benefit that we bring to that discussion is that whilst we've seen the sector in Southeast Asia professionalize essentially since the Boxing Day tsunami, and more quickly after 2008 up until now, and we've seen basically the drawing on of the expertise from academia or practitioners or policy fields. And then as it's slowly professionalized, we've seen a lot of practitioners take over a number of those roles. So that's been a bit a challenge within the region, to make sure you have continued relevance, because we also don't want to end up becoming part of the issue and not being able to stand back. And so I think there are a couple of boundaries as well that we need to maintain as academics or people in the policy and training world, to make sure that we continue are able to do those deep dives and deconstruct and ask big questions. The second point I think that is important is, in the Southeast Asia, we've had a long period of time of a decade now where we've had relative stability in terms of people in positions. And what I mean by that is that there hasn't been much staff turnover within the sector. People might move around different organizations. Somebody might be in the Red Cross one year, and then the next disaster, then they're with another one, WFP or some other organization. And what we see is that when we go from crisis to crisis or disaster to disaster, is that often a number of those same issues are coming up time and again, and they're not really being addressed in any consistent way, and lessons are really being lost. So for the academic community, the universities have a very important role to play in this as a repository of knowledge and a place where there's knowledge transfer. And we also have that level of independence where we're not going to be, well, ideally, obviously at the moment that is in question for a number of reasons, but we have independence where we can provide some honest brokering over knowledge between the different players involved. And that's particularly the case when we're looking at a region which is becoming increasingly strategically very polarized between one country and another, but also the issues that we're seeing is that they are having a lot of difficulty, I think, in terms of the replication of effort or duplication of effort. And particularly this is what we're seeing in the technology space. And one of the things we've been trying to advocate, and we're not getting very far with it, to be completely honest, is about the proliferation of platforms. Now, it's very popular to have an online data-driven platform for different issues. And the humanitarian or disaster relief space is no different to any other sector, I imagine. But what we're seeing is that a lot of countries or organizations are hosting or leading these platforms, but they are wanting other people to invest in their platforms, but are unwilling to invest in other people's platforms. So we're taking the politics out of real life and put it online, essentially is what we're seeing, because they don't want to give up their own data to others. So we have a real issue over trust. And the way that the region works is really built on trust. So if we're seeing threats to trust, when we're looking at working together collaboratively for major disasters, and that's particularly when the regional organization gets involved, when a state asks for help from the neighbors, or the neighbors offer help and they welcome help from them. So again, a bit of politics and how that works out. But what we're seeing is that there's still not enough trust in terms of sharing of data. And so what we've done on the strategic side of things, so moving away now from that sort of knowledge brokering and training, is in the policy realm, we work with the ASEAN Secretariat and in developing policy. So we've worked within the region to look at a regional based platform that has buy-in from its member states, but is also open to partners, both external countries and other sectors, so the private sector and UN organizations, IFIs, and so on. Now, there's a great example in the region, I'll just use that briefly in the time I have, is Kita Match in Malaysia, which was established during COVID. And this was essentially launched by a consortium of partners with the backing of the Malaysian government, including the Malaysian Red Crescent. We had the private sector involved, and basically what it did is it provided a platform to bring people together for the local community organizations to put in their projects, and for donors to engage in it and have faith in those projects were going to be well managed, and the money wasn't going to be used for nefarious purposes. And this is generally the kind of fear of donors with local organizations, is that they're not willing to give up the reins of the money. And this platform has really been a way to facilitate that trust building. So there is a positive element to it. So it has been working on a national scale, but we're hoping to see that a bit further across the region in terms of developing this space. The second thing I wanted to answer here is your other question on how do we professionalize this sector. So we've been running for a couple of years, and I noticed there was a comment there about strategic foresight. What we've been running is something we call humanitarian features. So we've been working with people in the UK and Geneva, and we've developed a workshop for practitioners where we do a lot of backcasting as well as projections from 2050 to now. And as I mentioned when we were talking earlier, a little bit of what we've been doing with the Secretariat has also been looking at the Regional Vision Document 2025. We've just completed the midterm report for that, but pushing beyond that. So we're not just having a midterm report, what didn't we meet at this particular point, but it was 80% forward looking. So beyond 2025, we better start thinking now what we want to be doing in 2035 at least. And obviously beyond that, where we can actually get buy-in. But there's always difficulty with strategic planners over, depending on who you talk to, on the length of time they're willing to look ahead. And so where we ended up was 2035 as that ballpark. So that's been a bit of what we've been doing here. But in terms of professionalization, does it lead to better outcomes? I think I'll end with that. I mean, we have seen that it definitely has, but also what we see is that it can also create very firm silos. So one of the biggest issues we face, I think, in how governments and non-government organizations, both private sector and others, engage is that we're replicating silos, and there really needs to be much more integrated thinking across different sectors on how they can work together and how they can collaborate better. And so I think one of the downsides is, unless professionalization also means integration with other sectors, then we'll just be replicating a silo. So I think I'll end there, and hopefully I didn't go over too much.
Not at all, brilliant. I mean, it's fantastic. I love the fact that you have both the almost a meta perspective, conceptual approach, but also sort of dealing with the realities on the ground. And of course, the realities that we're all of us dealing with. I mean, the issue of trust is always an issue, and of course, trust is transactional. People say, "I don't want to work with you because I don't trust you." Say, "No, you don't trust me because you don't work with me. If we did something together, that's the way we build trust." And of course, then the other thing that you're talking about is integration. And when we talk to people, we say absolutely what we are not doing in any context ever whatsoever is trying to teach you how to do your job. That's not what we are here for. What we are trying to discuss is how we can create an overarching architecture and framework which allows everybody to bring that together, which I think is one of probably, if we had our first three things we identify, that's at the top. And if we have the last three things, which we keep banging our head against 10 years later, it is exactly the same point of integration of multiple stakeholders in a way which allows them to sort of have information sharing, information exchange, common operating picture, situational awareness, etc., etc., etc. Thank you for that. What I'm going to do is I'm going to make sure that I cannot in any way be accused of bias, internal, external, conscious or unconscious. I'm just going to go in the order I see you on my screen. So that brings up Nadine. There is no judgment involved here. I'm going to bring up Nadine. And of course, what you're doing is you're taking this from a Erasmus perspective, deep into the communities of Indonesia, which are facing incredible challenges as well. But you're doing some really strong work there. So looking forward to hearing about that. Nadine, the floor is yours. Looking forward to hearing from you.
Hi, thank you, David, and hello from me. It's an absolute pleasure to be here and to listen to what the other panelists have to say as well on the subject, and to share some insights into the work that myself and my colleagues are involved in Indonesia. To start with, a bit about myself, I work at the Gloucestershire Business School in the United Kingdom. And I have been involved in international partnership work for quite a few years, and have developed partnerships across Southeast Asia, including Singapore, Malaysia, Indonesia, Vietnam, Myanmar. And I am now leading a project which, as David has already introduced, is called Building Universities and Leading Disaster Resilience. And this project, which is running for 3 years, we're 2 years into the project already, is aimed at developing a disaster resilience framework for Indonesia's higher education sector. And what we're doing very much echoes quite a few of the things that Alistair has already talked about, just very much about trying to get different stakeholders to work together. And this is quite challenging because obviously we are looking at not just the national level, we're particularly also looking at the local level, and we're trying to understand how universities can position themselves as key agents in driving disaster resilience in its widest sense, and how universities can bring stakeholders together. And what I'd like to do is to take you back about 3 years and tell you a little bit about how this project has come together. We were at the time already working with a group of universities across Indonesia, across Java, on another Erasmus funded project, which was focusing on developing entrepreneurial capacity building. And it worked in a similar way as the project that I'm going to describe. So we kind of could build on that methodology. And as many of you will remember, 2018 was a particularly disastrous year for Indonesia. We have first of all experienced the earthquake in Lombok, then the disastrous triple disaster in Palu, and then the volcanic eruption of Mount Krakatoa later that year. And some of the universities that we were already working in partnership with were directly affected by these disasters. And other universities have been able to support some of the relief actions, the relief initiatives, by mobilizing staff and students. So for example, one of our universities, partner universities is Islam Indonesia. Our colleague Wing is actually in the audience. And his university has mobilized medical teams, including staff and students, to those areas. And we, after that, came together as a group of universities and thought, okay, there is a lot that we have to offer in terms of supporting communities, not only in terms of developing academic courses, in terms of driving research and knowledge transfer, but also in terms of providing disaster response capability. So this project was really born out of us really already working in partnership, having very strong relationships. And I think this is where I was very interested in hearing the discussions that we've just had about trust, because we knew that we could work together. We knew that we could work together on a very complex project as well. And what we tried to do was to bring together our networks, our expertise, and coming up with this proposition, which I'm about to describe, and which is seeking to bring together different stakeholders. So the BUILD project is aiming to set up 8 centers of excellence in disaster resilience across Indonesia's regions. So we are working in all 5 major regions. And these centers, we would like to be hubs that can drive curriculum development, knowledge transfer, research, disaster awareness training, which is a very important part as well, because some of our partner universities in Indonesia are very expertised in working with communities, and not just in providing disaster aid, but also in terms of driving disaster awareness training. And of course, we would like to develop internal disaster resilience, disaster response capability, whereby we would like to set up universities to support emergency services in the event of a local disaster. Now that sounds quite simple in the way in which I describe it, but it's not simple at all, because this disconnect that we see between different stakeholders, and the fact that there maybe isn't an ideal level of integration, is what we're seeing at institutional level as well. And I think this is really where the BUILD project can be quite powerful in bringing stakeholders together. Now, I've just mentioned the different areas, the different work streams that we are focusing on. And if you're looking at how universities are working as institutions, you have one unit which is overseeing curriculum development, maybe another unit that is driving research, another unit that is driving community outreach activities, another one which is engaging with government and with policy making. So very often these activities, these streams of activities, are taking place in silos. And that's why in many cases degrees are not as effectively designed. They are not as industry close, not as industry relevant or practitioner relevant as they could be, because those different units are not speaking together. So one of the biggest challenges, and that's literally what I'm doing with my colleague who's very experienced in this field, what we're currently doing is to try and find a way of how we can create these units within each institution. And organizational structures obviously are different, contexts are different. So how can we create a model whereby those centers are acting as hubs that bring different streams of activity together, and that also add value, so that curriculum development is informed by research, is informed by community outreach activities, by work with emergency services, etc., etc. How can we ensure that if we have a unit that can deliver a disaster response capability, how can we ensure that research then comes into play in terms of delivering post-assessments? How can we use all of this knowledge to enhance our community outreach activities and improve disaster awareness training? What can we learn from communities in terms of informing curriculum development, research, knowledge transfer, innovation, and so on? So you see, what we're trying to do is to create this hub, but in terms of finding an ideal structure, and then also making sure that the governance, the institutional governance, is designed to make this model work in a sustainable way, that is quite challenging. And then, of course, the next thing that we need to think about is how we can scale this this model up so that we start to talk to ministries about educational policy, or maybe policies related to building disaster resilience nationally or also regionally. So our solution for this is to connect those different centers through a national network. And again, this national network is going to look at different aspects. So we're going to have an arm that is going to look at curriculum development to carry on with the scholarly debate. We would like to have one for knowledge transfer. We would like to have one which is overseeing fundraising as well, because of course fundraising, not just nationally, but also at a local level, is very, very important to support disaster aid initiatives, but also, for example, to fund scholarships. Because another thing that we found is that disaster management as a profession across Indonesia isn't actually that well known, isn't that sought after. So we want to increase the attractiveness of this profession. Now, how are we going to do this? By giving it authority, and also by making sure that we're working with the right partners, nationally and internationally, to give it due accreditation, that we co-design the curriculum with those institutions, with those agencies, and so on and so on. So there is a lot in terms of trying to get different stakeholders together. I think we have got an ideal model in mind, but the actual implementation is quite challenging, simply because organizational structures are very different, cultures are very different. As Alistair has already said, the willingness to share information, not just across different stakeholders, but also within institutions between different departments. That's quite a challenge, because there's always going to be a certain level of competitiveness between different units and between different centers that might already exist. And what we're trying to do is to really consolidate all of this and capitalize on the networks and also the expertise that our different partners and also the different universities have. So I think, David, that's all from me. I see that I've about covered 10 minutes. So back to you.
Thank you. As you say, I think we all get to the stage where we go, there's just a lot. There's a lot. There's just so many things to talk about. So many, and it's all over the place. It's very much like herding chickens. You're just trying to get all the chickens somehow to move in the same direction. Really interested to hear what you said about within the universities not having agreement. Where I did my doctorate, I was asked after, when I finished my doctorate, to help maybe set up an academic institution. There were 5 different departments there which had a department of crisis management. There's criminology, policing, security and risk management, emergency response, and business, the MBA, all had a crisis management structure. None of whom talked to each other. None of whom realized that maybe it'd be good to talk to each other. And none of whom could agree who would own this institute. So it just fell by the wayside. You go, you're supposed to be good. What I love about what you're doing in Indonesia, which I use as a case study for many, many people I talk to, is the fact that you are leveraging out the capabilities within the university. Because of course, in many, many places, the university has more expertise than anybody else around, more expertise than the government, more expertise than the city managers, more expertise than the consultant, whatever it might be, they've got the expertise. And I say, what I love about what you're doing in Indonesia is that you've almost got 3 themes going. The first is upwards, to influence government policy. If we're talking about strategic policy, you've got to know how that works. You've got to have a conceptualization of how that works. We can bring that to the game, not because we can provide solutions, but we can provide a framework for discussion. And that is very, very important. So I think, being involved at government policy level, just trying to put a structure, again, structure methodology is important. Secondly, you have direct contact into the communities. You are absolutely embedded in the communities. You can access the communities. You can bring the community people into you. You can share best knowledge. You can create community networks, etc., etc. And third, you reach outwards and you create a consortium of stakeholder partners. And that can be NGOs, third sectors, it can be national infrastructures, funding organizations, community-based organizations, all of whom potentially have an interest in this, but actually need to have some way of plugging in, saying, okay, well, who do I talk to? And I use the Build program as an example of universities using their status within the community. We sometimes forget that in many places in the world, both the university itself as an institution and the people associated with it are of very high status. And they have the ability to, to speak to people and to knock onto doors and to bring people together and to put on a symposium, bring people into the same room. I think it's potentially very, very powerful. Okay, Jeff, I think we've set you up. If you complain you don't have enough to talk about, you haven't been listening, because I think we can basically hand over to you now and just sit back and leave it. Federal Emergency Management Agency, of course, is the big boy in the room, isn't it? It is the one we all look to, both for good and for bad. It has been at the front edge of trying to work out how we do this stuff. Of course, after 9/11 and then certainly after 2005. Your successes are often not seen. Your failures certainly are. We tend not to, crisis management tends to be the study of failure. But there's no doubt about it that you are certainly the largest organization in the world doing this. I think we are very proud because we have trained 10,000 people since the beginning of COVID. But when I listen to your numbers, I realize I've got to sit in the back of the corner of the room. Just very quickly, what is the number of people you train in a year through FEMA?
Yeah, so in 2000, in our federal fiscal year, which runs October to October in 2021, the Emergency Management Institute had 934,000 students take almost 2.5 million courses.
So if anybody wants to say they're training a lot of people, 900,000
it's a large scale
is a number.
On a very small budget. I always tell our budget folks that we're a lot of bang for the taxpayer dollars. We have about a $21 million budget. About $8 million is operating. The rest is our in salaries.
I want to be in an organization that says $21 million.
90 or so staff we have. Yeah. So
over to you.
I'm really honored to join you all, Nadine, Alistair, and David. And we have the advantages of being able to do all of this stuff so virtually as we now December 1st enter the third year of our global pandemic. But it's also, for the folks online, there is always something that's missed at not being able to see you all, your faces, your reactions, and sort of engage that way. I do want to thank Brett Mott, one of my colleagues at Georgetown, for linking us all together. And Brett, I think, is one of the founding members of the U.S. chapter of ISRM, so I appreciate it. So a little bit about me, a little bit about FEMA, a little bit about EMI, and then to pick up on this discussion of lessons revisited and the role of professional development and our institutions. I've been in public safety, homeland security, first responder work since I was 18, so three and a half decades now, and the system has certainly evolved from the what I would say simpler times when I thought I would just hop on a fire engine and go, help somebody at an emergency or get a cat out of a tree. Didn't think we would be dealing with weapons of mass destruction and global pandemics and all other kind of things. I do teach, as David said, for about the last 8 or 9 years at Georgetown University as well. Prior to coming to FEMA, to the Emergency Management Institute, where I'm the superintendent, I was the Virginia State Emergency Manager in the United States. So I worked for a governor. In 6 years, we led the state through about 50 emergency declarations, and that ranged from sort of usual natural hazards like hurricanes and tornadoes and the occasional earthquake to flooding, dealing with a lot of climate adaptation. Virginia has the world's largest naval base. In Norfolk, a lot of sea level rise issues and persistent flooding that are going on. To sort of more persistent, I saw the term the other day, anthropogenic. I'm going to mispronounce that, but sort of the human caused, people caused technological events, as we evolve that term. So a couple of nuclear power stations, the Charlottesville, sort of now infamous Unite the Right rally. I was sitting in the governor's, next to the governor's chief of staff and our sort of command room in the governor's office while that was all going on. So we've had a lot of civil disturbances and a wide variety of support. And I do want to greet you all in the Washington, D.C. area. So that's where I'm dialing in from for what is early in the morning here on the East Coast of the United States. As I said, I came to EMI. EMI is a 70-year-old institution. So for those of you in the UK, we are celebrating our Platinum Jubilee this year to steal that away from the Queen for next year for her celebration, 70 years old. We were founded in 1951 as the United States' National Civil Defense Staff and Command College, and very much the beginnings of the Cold War, with the perceptions at the time that we prepared government and the public for atomic or nuclear exchange. Focused a lot on training federal, state, and local officials. In the United States, it's important to understand for our international partners on the call, we have a system of federalism. And so there's the national government, but in the US Constitution, all powers not given to the national government actually reside with the state governments as a United States. And that widely includes disaster policy and disaster response. It exists at the state level. The governors of the 50 states and the territories and our tribal nations are prime for disaster response and disaster recovery coordination. And that exists in two clauses in the US Constitution, what's called sort of the General Welfare Clause, and then what we call the 10th Amendment. So it's important to understand that. And the federal government has always been traditionally a support to those state governments. And then depending on each state and each state's constitutions, the role between the governor and that local mayor or county elected official and the county level of government is different. And the authorities are different. So traditionally, pre-Katrina, FEMA, the federal government in the US, was a support agency. And over fairly the last century, the federal government, the national government's role in the United States has increased as the number of disasters have increased, as the federal government has gotten more involved in policy and operations. FEMA was created itself in 1979, sort of as we evolved from the Cold War and civil defense in the 1970s in the US and looked at environmental degradation and issues in the 70s and sort of evolved what we call the emergency management profession with a small p in the United States. And when FEMA was created in 1979, we ceased to be the Civil Defense Staff College and we became the Emergency Management Institute. And incrementally in supporting the profession, we have added programs on to our 361 courses, about 211 are online, 150 are in person. We have the capacity at EMI to host about 5,000 students a year in a non-pandemic year on our campus, which is in Emmitsburg, Maryland, just south of Gettysburg, Pennsylvania, where the famous American Civil War battle was fought. And then we do about 10,000 students and seats in what we call mobile deliveries. And so we were embedded in FEMA, became EMI, and actually really became sort of more of a technical training institute focused on technical training with the sort of program with fantastic training staff. But we sort of abandoned, and this is important, I think, for professional development, that sense of what is the role of academics and academic institutions. So we sort of ceased to have faculty at that stage. And then in the 1990s, we established what's called our higher education program, which the idea was to seed in the public and private universities in the U.S. emergency management program. So in 1993, there were 2 emergency management programs in the United States. There are now, in 2021, I think 327 universities that have associates, bachelor's, master's, and a couple of PhD programs in what we call emergency management. And then they have about 700 different programs in those universities. Now that's separate, David, from the Homeland Security construct sort of that developed post 9/11, where there's over 400 different Homeland Security programs in the United States. And as we look at our profession, at least from an American perspective, what we would call the sort of American national security professions, the sort of typical diplomats and folks engaged in global policy discussions, I presume sort of globally, that's more of the global security sort of role from traditional schools of thought on geostrategic politics. Our national security professions, again, at the beginning of Cold War, we were sort of this subset. And then we split off for 40 years as emergency managers. And it's only now that I think COVID has revealed, and a lot of the other global challenges that are going on, supply chain issues, civil unrest, that we need to be looked at and re-embedded as part of that construct of sort of the security element. So if you think of a professional development Venn diagram, sort of one circle might be sort of the global, or what we call national security. In the United States, one might be the Homeland Security construct over the last 20 or so years. One is emergency management, and now what you're very focused on, sort of resilience. And these things probably overlap in the 60 to 80% range, but we are treating them traditionally as separate backgrounds and separate areas. Now, within FEMA itself, the Federal Emergency Management Agency in the United States, we have grown a lot since Katrina. I think at Katrina we were about 3,000 or 4,000 people. We now have almost 20,000, roughly, give or take. People, again, in support of state and local governments, tribes and territories, engaged strongly with the private sector and NGOs. But again, because of that constitutional construct, we are supporting, and that's across what we call the emergency management cycle of prevention, response, recovery, and mitigation. I think some of the challenges that we are facing professionally is that we are very good at the technical training of teaching people how to write a plan, teaching people how to operate in an incident management system in an incident. What we haven't been so good at is teaching our technically proficient administrative staff and our professionals how to engage at the political or the policy level. And we also haven't been very good at educating the political and policy leaders on how to engage with this emergency management construct, this system that is sort of a break in case of emergency system that they mostly in an individual government operate rarely. And so what we saw with the pandemic, I think, across the United States, and this is in the US apolitical, whether it was Republican or Democrat, I spoke to a lot of my colleagues, again, was in the state role leading Virginia along with the governor at the beginning of the pandemic before it switched to FEMA, is we created, at least in the United States, a public health emergency management system separate from this all hazards emergency management system. And even though we spoke a lot of the same languages, sort of like Britain and America, two professions or two countries separated by the same language, we have two professions focused on preparedness, risk, crisis management, operating, that are separated by the same lexicon. We both talk about in the US the incident command system and incident management, but culturally are very different. And so public health colleagues very focused on trying to do research, trying to get sort of perfect information. They are not, with a lot of respect towards them, and there's probably some in the audience here or come from the public health community, not really ingrained in crisis decision making with limited information in a political environment. And so we saw that break down in the US, and I think somewhat globally, but especially in the US, because again, going back to that federal system we don't have one unitary response. And this is what distinguishes us, the COVID crisis, the pandemic, from Katrina. Katrina was a localized regional area, affected a couple of states. You had local governments, then the pyramided state government, the one or two governors, and then the federal government. And the failure was sort of an integration at that vertical layer. The complexity of dealing across 50 states in the United States, where each state has a separate set of public health laws, separate set of constructs, and those are separate and in parallel to the emergency management and sort of disaster laws, and then trying to speak in a political context with one voice as the data and information evolve. Here we are 2 years later with the I'll leave it at the sort of deja vu I think we all feel when we see a new variant, Omicron, and then lost in the information, the missteps in either public communication or the disinformation. We're at this stage now, I think, sort of globally, folks entrenched with where they sit on what might be the proper intervention strategy. So to bring it sort of back together, I think we have a lot of work to do in understanding what we need to do, what we're missing in our professional development. We're very good at the technical stuff, but we're sort of missing that policy and political interface. I think we're missing teaching people how to look across the strategic landscape for the entire cycle of a long event, a complex event that is diffuse. So a multi-year event, we're focused, and our American Incident Command System that a lot of nations have copied is really focused on a crisis that might occur in days. It was based on wildfire, a sort of model from the 1940s and 50s, or should take place over days or weeks, not something that's going to take place over 2, 3, 4 years. And that interfaces with so many other facets of our society, our economy, our politics. The Hurricane Katrina thing was a catastrophe, but it was because of a failure, I think, of that vertical intergovernmental integration in the United States. We're seeing a lot of challenges. Almost 800,000 people have died in the United States from COVID now, because we haven't in 2 years adapted to how this complex event is. Really is integrated with so many other facets of society, and then we put a political decision maker in charge who's got to weigh on, do I try to support the hospitals and the public health, or do I crash the economy, and what are the repercussions of that? That's hard for anybody, Democratic, Republican, or whatever is represented. I'll stop there and I'll pause. I'm happy later on to dive into what we are going to do at EMI to hopefully reshape the American professional development system. But as you said at the beginning, like where do we start on this interesting area? So thank you.
Where do you start? As you say, it's like eating an elephant. It's the first mouthful. If you get the first bite, you can work out from there, but it's the first bite's a tough one. I love the fact that you're differentiating, Jeff, between training and education. I think a lot of organizations mistake those. They don't realize, they claim they're doing education, but actually they're doing training. Of course, training is a lot easier because it's task orientated. And if we can extrapolate that out, I think one of the challenges with the ICS Incident Command System is exactly what you said. It's an incident command system. It is a National Incident Management System, NIMS. The clue is in the name. It's not crisis management.
That's right. So to pull on both of those strings, I use an expression I've been asking somebody because I stole it somewhere. I saw it somewhere years ago, and I don't know who I need to give credit to, but I like to use the expression that training is for certainty and education is for uncertainty. And that to me is a way of drawing a distinction between the two. At EMI, we hope to add the education piece back in integration with those other education pieces to draw that knit together. And then when it comes to ICS and Incident Command System, I was talking to one of my colleagues, a former boss, a mentor, a gentleman named Jim Schwartz, who was the Arlington County Incident Commander at the Pentagon on 9/11. He teaches at Harvard at the Kennedy School, since retired. And he's put a lot of thought into this, and we were having coffee last month, and he was postulating that maybe we should be calling it the incident collaboration system to sort of reshape that mindset. Now you get into, there's long time standing academic debate of top-down command and control, which ICS is designed from, embedded, and then bottom-up sort of decentralized, more agile approaches. And I think what you find is it depends on the nature of the incident where that construct needs to sit. We keep trying to put one model on it. We're seeing the failures in that system, and even the failure to sort of educate people on how that system is supposed to be adaptable and flexible and be able to build a unity of effort, what we call a unified sort of command model. Still befuddles people when we put them all together. And somebody thinks somebody needs to be in charge. It's like, no, David, what are you in charge of as far as your portion of the incident? Now, what are you in charge of? Nadine, what are you in charge of? And then how do we coordinate that together with a unified set of objectives? So we have it. And to go back to what Nadine was talking earlier about lessons, we've been so busy responding to event after event after event after event, especially in the United States, that I don't think we get time to read those lessons, much less embed them into a cycle that strengthens our individuals and our organizations in a cohesive way we're just so busy, and we're like insurance when it comes to emergency management. We're buying the minimum amount at every level of government that we can get by. And so there's not that sort of institutional capability to adapt until a focusing event happens. And then we were told by outsiders how to reframe. And so another part of the profession and teaching people how to engage with policymakers, and teaching people how to bring the academic educators and the researchers and the policymakers and the practitioners together is we, whether you're a resilience professional, an emergency management professional, we need to put ourselves in a position, which we haven't been for 4 years, where we are driving and influencing the law, the strategy, the policy, and the doctrine in our nations for the profession. And right now we're sort of subject to what I call drive-by influences, I think, in most countries. I certainly can speak for the United States.
Okay, good stuff. I mean, the government and emergency response. There was something on LinkedIn a few years ago, I think 3 or 4 years ago, in one of the chat groups. What is the most dangerous phrase you've ever heard in emergency management? And it's things like, it's okay, we've done this before, or it's okay, I have a plan. But the most dangerous phrase by far is, I'm from the government, I'm here to help you. And if you hear those, then you seriously know you're in trouble. Let's loop around the table. There's just so many points there. But one point I would like to, well, a couple of points I'd like to sort of just use as maybe a leitmotif to discussion around. If you look at the 3 major reports that have come out of America since 9/11, there's one after 9/11, 2 after Hurricane Katrina. The congressional report into 9/11 was called a failure of imagination. A failure. We did not think that was going to happen. That was a mistake. The report that came out of, the first report that came out of Hurricane Katrina was a failure of initiative. We knew it was going to happen. We still got it wrong. And the third report that came out, the retrospective report, was a nation still unprepared. I think that probably captures everything. We've got a failure of imagination, a failure of initiative, and we're still unprepared. I mean, just basically we can use that as a framework. But of course, the thing is, that has consequences. That has consequences. There have been 150,000 deaths in the UK from COVID. That did not have to happen. You know, there was a different narrative where there was in a different universe, there's a different story where those 150,000 people did not die. Now, some would die, but you did need 150,000. So getting it wrong has consequences. Therefore, the question has to be, why do we allow us to get it wrong? Because we don't allow people to build skyscrapers which fail, or planes which crash, or et cetera, et cetera. Why do we have this concept of crisis management that does not work? Because we've been doing it for 50 years. And so I think that's a challenge I think we have to accept, because if we know this stuff, either is it not good enough or not robust enough, or do we not have a voice at the table, or why are we not having the influence we should? Why are we not better? Because if we can't handle the 2020 challenges, let's wait for the 2025 challenges. Let me see, that's going to be bad. Right. Let's just stay in order. Alistair, let's come to you. Feel free just to riff off anything you've heard. Or any points you'd like to raise, feel free to go.
Sure, thanks. I'll just build off something Jeff said, and I'm thinking now about where our entry points have been from where we sit over the last 2 years. So we've been doing quite a bit of research now in the overlapping areas of disasters and during the pandemic, because that has impacted things like evacuation centers in the Philippines. It's now down to, say, 50% occupancy, or in Fiji, we had massive delays with customs and excise, going from the usual reasonable turnaround to 5 to 7 days taking it. So in which case, you know, the goods are no longer necessary, and you know it's after 72 hours. So the worst kind of things have happened. So I think the point I'm making here is, for us, we're looking at it in terms of building off what people are already used to thinking about and trying to overlay it with this current large-scale problem that we're facing. And that's been one way that we've tried to build bridges between between public health and disaster management, is by showing them where in a fairly simple way that you can have simultaneous or concurrent disasters, whether it be a pandemic or a natural hazard. And we don't need to go too elaborate for that to have like immediate impact in discussion and thinking. And then from that, I think the other issue that we have as well is just in terms of getting people to think about those longer term projections. And it's not something you can do in a workshop. It's not necessarily something you can do in a short course. It is going to have to be part of a longer term academic training or education. You made a distinction there to do it in terms of getting used to the methodology, in terms of scenario development and so on. I think that there's a lot of time people just need to have space and time to think about the improbable. One of the mottos at RSIS is pondering the improbable. You can't do that in a 12-hour a day, 5-day a week.
Is that what you get paid to do, by the way? Because I'll come and
ponder the improbable.
Yes, you said, well, it's okay, boss. I'm pondering the improbable. Leave me alone. It's fine. Just.
As in, when we have all these short courses, and we're doing them ourselves, right? Where we have 5 days, have a cram course, and we're expecting people to be able to think about these alternative scenarios over the longer term. It's just not possible unless you have time to think about it, and that's where that education component I think comes in, and it's really important. So I mean, that was my initial comment. I'll stop there. I'll come in again a bit later, but that was just something I wanted to add on to what Jeff is saying.
Great stuff. So Nadine, let's come down to you, because again, you are triple playing it. You are into the policymakers. You're in the community. You're working within the wider networks. Are you able to influence? Are you not even over influence, but are you able to be a vortex? A vortex, spins and it brings everybody into it. And is there interest? I mean, do people understand the value of doing this? I mean, is there a supportive environment within which you're operating?
It's an interesting question, David, and I think we are probably basically it's a little bit too premature for us to understand the full impact that our work is going to have.
That is an academic speaking. I need more data. I need more data. Yes, exactly. But no, I mean the interest in the project and in the framework that we are developing, that has existed certainly in Indonesia from the beginning. We have talked to the National Disaster Mitigation Agency. We've talked to the ministries as well. We've talked to disaster aid organizations and sought their feedback, and they have said, yes, this is something that we need. The question now becomes how we are going to work with those agencies in the future. I think this is the bit that we probably have not arrived at yet, because we're very much still focusing on the local level. And once we have set up centers at local level, we've got models of working in partnership with external stakeholders, with local emergency services, with local authorities, with businesses, with communities. Then we can bring the discussion to a national level. And that's again something that we have been discussing at the very beginning of the project, where we felt that in order for this to be successful, we need to take a bottom-up approach. We need to understand the diversity of issues that a country like Indonesia might be facing in different regions, and then bring all this knowledge together before we can really talk about influencing policy making. But I think for me, there are really, I suppose, 3 points which I'm particularly interested in, because obviously from our perspective, we started with an Indonesian perspective. We thought disaster management is something that is particularly important for Indonesia, given its topography, given the number of natural disasters and hazards that the country is facing. But the more we are working in partnership, not just in Indonesia, but also with our European partners, with our associated partners like yourself, David,
we are realizing that this is not an Indonesian problem. This is a global problem. I mean, this is very much what Alistair said, was also what Jeff has said in terms of that lack of structure, in terms of understanding how different agencies can work together in a way that's efficient and meaningful, but also in terms of how we're designing education. And that for me is a really interesting part. So basically, what does the disaster management, the emergency management profession look like? How can we, and what does this mean for education? What does this mean for educational models? What does this mean for curriculum development, for the pedagogical methods and approaches that we're taking? Because I don't feel that certainly, I mean, I sit in a business school, I have a particular perspective, but I'm not sure whether we are actually in a position where we understand what education for disaster management looks like. We may have an understanding of the body of knowledge, maybe what kind of subject we should be teaching, but the question really for me is, how do we teach disaster management, crisis management, emergency management competencies? Our teaching methods designed to get people to think in the way in which they need to think in order to understand hypercomplexity or situations where they need to be super adaptable and integrate information from one second to the next in order to inform the next decisions that they're making. And I don't think we are there. And I think for me, this is very much a conversation that needs to go with everything else that we're talking about. So what does a governance structure for emergency management look like nationally? What does it look like in terms of education? How do we need to bring people together? And do we really need to go back to the drawing board in conceptualizing what education means in that context?
The question is, so sorry, please come in.
Can I jump in? Because I
please.
agree with Nadine, and I want to share, from my perspective, we professionally, we've sort of been in this long, slow transition. We talk about ourselves as professionals in emergency management. We are professionals. That does not mean we are a profession. And we have a lot of debates in the United States over that. We have been in this long, slow slog, evolving, I think, from tradecraft towards more of a profession grounded in a common body of knowledge. But in doing so, we've, at least in the US, gone through fits and starts, and to the extent that the world has sort of tried to copy us as we've been going through those fits and starts, that's probably to the challenge for everyone. Originally, as sort of tradecraft and as a training, we have had several constructs over the last 40 years for professional development in the United States. We started as something we called our Advanced Professional Series. Those are a lot of EMI-based classes in the 1980s and 1990s. That still exists. We have, through another association, the International Association of Emergency Managers, a certified emergency manager program that has developed over the last 20 years, where people will sort of take a dozen different characteristics of their education and training and experiences and other things they've done for the profession and present that to a voluntary board for certification and take a test. We have added over the last decade in the United States what we call a sort of an academy model, basic advanced executive academies, where people will go take 160 hours of training for, say, a basic course academy, another 160 hours of training and education for an advanced sort of an executive program. All of those have been stacked onto each other without abandoning the models before, which has led to confusion. And then on the higher ed model, again, with growing these many associates, bachelor's, and master's programs, the higher ed community has created, in the emergency management community in the United States, a set of competencies, but they're not always taught. They're not always agreed upon. And I would postulate, based on what, sort of building off what Nadine said, based on the way we're seeing the world, they're inadequate for the pace of change and the challenges, and the fact that, again, it's not just do a plan, do some training, do some exercising, focus on this response. This is a now complex, multidisciplinary, interdisciplinary environment that involves lots of aspects of society. And so, sort of probably do need to go back a little bit to the drawing board to determine what is missing from that based on, you're representing risk management. There is crisis decision making, public communications and risk communications, a whole sphere of data analytics that can be applied across the spectrum. That is a new skill set in the United States. We're trying to understand climate adaptation, hazard mitigation, equity and socioeconomic vulnerability, and the underlying factors outside of a disaster, but where our policies are leading to negative, further exacerbating the problems in society rather than helping those that need the most. And so I would sort of building again on what Nadine has said, postulate that we are sort of competencies or sort of what we're looking at doing really does need to be revisited. We are having that debate internally at FEMA. We're trying to draw out career pathways for FEMA personnel. And a lot of these issues come up. What does it mean to be an emergency manager? And when we say that, does that mean the same thing to everyone? I have a perspective of a professional emergency manager that is drawn upon some basics of understanding of disaster sciences, some understanding of human behavior, economics, basic administration and management, certainly prevention, preparedness, mitigation, response, recovery. Again, politics. To a lot of people, being an emergency manager is about that crisis job and that it's a command structure, divorced from understanding what the root causes are. So until we resolve some of that, we're going to continue to have these incidents that pop up. And the political level is operating at Twitter speed. It's not a 24-hour news cycle. It's a 24-second Twitter cycle for the political leadership in all of our countries. And so until we match the needs to that and do that in a context that both satisfies that 24-second need for the political leadership, and again, as I said earlier, though, can build processes that work over multiple weeks, months, years for these long-term wicked problems, we'll continue to have these nice discussions, I think, and wonder why we haven't learned lessons that seem to be struggling, divorced from, as a profession sort of set apart, looking at what's going on, saying, hey, we know something about this, but not being able to influence it. Again, a lot of places to go. Sorry for, I probably need a second cup of coffee here in the US to settle.
Excuse me if I was slightly distracted, but I was looking for a quote. There was a quote which has been triggered by this discussion. I just want to read it out. It's just a few lines. 3 decades ago, there was not enough theoretical material or research work on response to social crises and disasters to have warranted more than a footnote attesting to that fact. A paragraph could have summarized all of the relevant work and activity of 2 decades ago. Even 10 years ago, several pages might have sufficed to summarize totally the burgeoning activities in the area. The growth of the area, that is crisis management, emergency response, the growth of the area has been exponential, not linear. And today the research efforts and theoretical advances have reached such a level as to force us to be highly selective in our coverage in this paper. That is from an academic paper, and I think we'll all agree with that. That comes from 1977.
Yeah.
It comes from
so
1977, 50 years, 45 years ago.
For the 70s, again, that's probably about right on the time frame. The 1950s and 60s began a lot of studies, especially by sociologists in human behavior, disasters, and disaster research. We've got this wide body of knowledge. What we are missing is the fact that the researchers are siloed and have been for decades in their area. The educators are siloed for the most part. The practitioners are in a third silo, and the policymakers in a fourth. And so we're actually trying to think through what our role is at EMI in the United States and institutionally becoming a catalyst to bring those groups together so that we can have those debates that are informed by that research, that feed into education and practitioner knowledge that can influence the policymakers in their making of the laws and policies and decisions about strategy, because we haven't done it in our field of endeavor, whether you want to call it emergency management or resilience, the way other, again, sort of, I'll refer to them for the international audience as global security professions. Again, in the US, we call it a national security profession. The militaries around the world have robust institutional models that determine what kind of war should they be preparing for, what are the capabilities they need, how big should a Navy be, what is the right mix of airplanes and armies, and the diplomats have huge institutional schools and conferences and think tanks that think over how to sort of position different nations or, the different geostrategic issues. We don't have an institutional model for that. And again, our little p profession. And I think then we sort of wonder, we shouldn't be surprised, I think, without those institutional models in place, how again, when a event happens, policies need to shift or change, why we are not at the table influencing that, or why we are not perhaps have the right people in the, in Britain in the COBRA room, or in the United States, perhaps the emergency managers in the governor's room or in the National Security Council at the White House that have an informed sense of that crisis management.
Can I put that into another context?
Sure.
Because the context of the United States absolutely is fracturization. It is fractured in every level. On the theme was meant to bring that together. Alice, if we bring that into Singapore, of course, Singapore is an example from almost of a centralist state, isn't it? That if Singapore decides it wants to get something done, it gets something done. I mean, there's not really much doubt about that. Does that have an impact on the way that you can create solutions and you can put solutions into play? Do you feel that you're seen as a useful tool within that playbook?
Oh, well, we're integrated into that system, right? But I mean, from a regional perspective, it's an outlier case, to be honest, right? We're looking at an island city-state, which is developed. I just wanted to hook back to something Jeff had mentioned. I wanted to add one component there, and that is financing. One thing that comes up time and again in Southeast Asia is who's going to pay for it. And most of the time, we're looking at the regional level, where there's varied levels of development, and there's a lowest common denominator approach at the regional level. So whoever the country which has the least ability to pay, that's the same that everybody pays. That's the model that is in place. So then there's all conversations going on over private sector engagement, insurance companies, should it be taxes, should it be, and who's going to pay for it and how's that going to look? And if it's going to come from development partners, are we going to have to be doing some quid pro quo for development in a particular area? Or there's a lot of politics around money in the disaster management space here. And so I wanted to put that kind of right in the middle. We've just completed a survey as part of the ASEAN Disaster Resilience Outlook that I mentioned earlier. And conversely, policymakers always talk about engaging the private sector in financing. So you'll hear about cryptocurrencies, you'll hear about all these different things, insurance and so on. Insurance is about 2% of people in the region. So it's really small fry, to be honest, even with all these elaborate ways of doing it. But the majority of people that were surveyed said the government should pay. Right, so we have like a huge difference between governments making policy in this area saying we need to get private sector to pay, and then you have everyone there saying no, we pay taxes, you should pay. So there's a big question, I think, about money and how, when we're looking at institutional development or looking at professionalization or how the responses are going to be organized, is that a simple question on who pays. So I didn't want to take up too much time on that. So I think I'll hand back to you, because that was just something that occurred to me and I wanted to add that in.
It is very, very much this idea of who pays is the unspoken question. I'm always, when you're around these conversations, as I said before, I always get the feeling that you're in a very nice restaurant and everybody's looking at the wine list and trying to work out who's going to pay for it, because I'm not paying for it. And until you put some money on the table, nothing really gets done. One of the points that was made yesterday in the governance and policy thing it was made by Mohammed Nasheed, the ex-president of Maldives. And it says that when you look to the poorer nations of the world, who of course are the ones who are impacted by the challenges we're facing nowadays, it's not just they don't have money, but they are incredibly debt-ridden. They're spending 30% of their gross national product on just paying off debts to other institutions, often private institutions. And often their own infrastructure is itself crumbling. So they're paying money for infrastructure that doesn't work with money that could be used to pay for their infrastructure. So once you start talking about money, it becomes, again, incredibly complex. Can I ask a question? Can I sort of open this up? If, as Jeff said, you know, there's a phrase from Boyne to Hart, 2003, a dereliction of duty, a dereliction of duty. You know, and if you look at governments, governments have the responsibility to ensure the safety, security, and well-being of their population. And we're seeing a dereliction of duty. I think academics have a duty to be able to discuss this in rational ways, which have utility, which has usefulness. As I'm sure Jeff teaches at FEMA, you know, you have data, you have information, you have intelligence, and then you have actionable intelligence. How does that help me do my job better? Well, if we're sitting in our classrooms, our institutions, our universities around the world, doing this stuff and have done it for 50 years, and we still can't help the world get it right, is that a dereliction of duty? Because that has an impact, and that is bad. So before we sort of open up to the floor, there's some really good questions there. To follow up on Jeff's point, why the hell can we not get this right after 50 years? Why can we not get it right? As you said, you talk about the military, but then you look at Afghanistan and say, well, okay, well, that's a bit of a misunderstanding on everybody's part. But I mean,
yeah, I'm not saying we should copy, you know, the successes or lack thereof of our national security colleagues, but certainly we need to be embedded, because that's where the leadership for a lot of the crisis management around the globe are coming from. A lot of our, you know, our cabinet level officials at the federal level and all of their staffs, a lot of the state and local officials tend to come from sort of those worlds, less so from ours. And I think we need to be at the table. And I think we're slowly moving and positioning ourselves to be there, but we've got to, I think, constantly, again, going back to what Nadine said, look at what are we really doing to develop ourselves, and are we just still stuck in that sort of I want to say pre 9/11, pre Katrina, but that sort of you know, again, those are 15 and 20-year-old crises. The world has continued to evolve. What else do we need to know beyond just that technical, how to organize an intergovernmental, interagency response to a specific crisis that's delineated in a specific space and a specific time, which both of those were, and get into more of these complexities. And I'm very, having worked for political figures, both Republican and Democrat in the United States, at the federal level, I've worked at the White House. At the state level, I've worked for 2 governors. I am empathetic with the challenges that they face, because it's easy for us as crisis managers, emergency managers, to stay focused on the sort of fire burning in the corner and say we have to go put it out and everything else needs to be set aside. And so to build that transition to the pandemic, initially it was about, hey, that's how do we save the most lives? And we're looking at this through a public health lens with a lot of uncertainty. And ideally, we do want to save the maximum number of lives. But at the political level, they're trying to balance out life-saving health precautions with the repercussions of the economy and what that might do. You know, all the shutdowns that we've seen around the world, the cascade impacts into the various different supply chains, and then certainly in the West, I think this is fairly global, the civil unrest that has been rooted and come out of those stressors. So they're sort of trying to dial a bunch of different things to get to some Pareto optimal, some I should say notional, maybe fictional, ideal Pareto optimal decision with a lot of different pressures coming at them. So I'm very empathetic, and I think we have a role to play in trying to help teach them how to do that better as well. That's also very hard. So, but I'm not sure I would say that we've totally failed, but it certainly doesn't feel like we're succeeding. Maybe I'll leave it at that.
Nadine, what's your feeling again? Because you both work again. We haven't even mentioned your work in the UK, because you're obviously involved in the UK university system as well. But that, and in Indonesia, are we influencing the dialogue? Are within very, very complex environments? Are we bringing something of value to the table? Just to go back to the point you made, Jeff, about sitting at the top table. I mean, I've been involved in this conversation on security management, literally security, not risk management, for 30 years. I opened my first consultancy in London in 1991. So that was 30 years ago. And right at the beginning was, how do we get to the executive suite? How do we get into the C-suite to talk to people? And I used to say, you need to belong there. You need to bring something of value. You need to be as good. If you want to sit in the C-suite, you need to be as good as what you do as their tax advisors are, as Ernst & Young or Goldman Sachs are, or Deloitte, because they belong there. And if you want to be there, you've got to be good enough to be in that room. And a lot of the times we haven't been good enough. We have not been good enough. And I think that one of the things we've seen certainly over the last 20 years is this word professionalization. We're beginning to get the skills to actually belong in that room. But we have to bring something that is of useful. And it's not just words that we can bring or models, but it's, how does it make your organization better? How do you bring substantive value? Sorry, Nadine, I got off on that one. Let's come back to you.
That's all right. Now I think I'm pondering about the question as to why we still haven't got it right, particularly.
Well, if you worked with Alistair, then you get paid for pondering. You could and get paid for it. I mean, how good is that?
No, I think the answer to that, David, is very simple. And it's, if you're looking at how academics are working, many academics themselves are working in silos. Academics generally have a lot of freedom in the way in which they are designing their courses, and also institutions in general have a lot of freedom in terms of how they are designing their courses. That freedom gets restricted or constrained when you have courses which have to be accredited by a regulatory body, where there's certain standards that need to be met. But in disaster management, certainly what we found, we don't have that. And this is where the problem starts. So unless we get to a point where we say, this is what disaster management education or emergency management education looks like. These are the standards that need to be adhered to, unless there is recognition, not just nationally, but on an international scale. And unless policymakers say, yes, we require every disaster management, emergency management course to meet these criteria, we are not going to get it right. The question then becomes, how are we going to get to that point? It reminds me of a conversation I had about a year ago with our head of school, where we were thinking about how the pandemic has fundamentally, well, not fundamentally, but it has encouraged universities to reflect on their role in society, and also to reflect on their duty in supporting society. Because I think the pandemic has put universities into a situation where, certainly in Europe, they haven't found themselves before, where all of a sudden fashion design studios were used to produce PPE, or where all of a sudden all the nursing courses were put on hold because students were supporting the NHS, or where fundraising campaigns were started to support businesses in crisis, or where, for example, universities have supported local businesses to move their trade online, which is what we've seen in Indonesia. So there were all those initiatives where universities have started to mobilize resources, and also have started to mobilize their staff, volunteers, in order to respond or to support the COVID response in a way that we haven't seen before. And I think this really is the beginning of something else, of something bigger, and of a bigger debate where we can really think about, right, how can we bring this together? And actually, yes, as educational institutions that are supporting communities, we do have a responsibility. And I don't think that so far that sense of responsibility and that sense of urgency existed in a way that it's beginning to exist or emerge now. So, sorry, this was a bit of a longer answer to what I said would be a very simple answer, but back to you, David.
Anybody who thinks it has a simple answer has to leave the room, let me tell you. Fine. Alistair, let's come to you for final words before we sort of open up and go to some of the questions.
Sure. So can I just agree and disagree with what Nadine has just said here? I think it just made me think of a conversation I had when setting up the program 5 years ago. Is somebody had said to me, oh, first came the medics, then came the lawyers, then came the business schools. And so it's disaster management school next. And I was like, no, please, no. You know, we need to be integrated across all those different schools. We can't just go and create our own silo. And I think it's really important what Nadine had said about imagining the core function, and you referred to the duty of universities to be supporting their immediate communities around them. Mm. Now, this is where I'm going to contradict myself. This doesn't work under the current model, whether it's in the UK or anywhere. Well, maybe US is different, and certainly not in Southeast Asia, because we're not evaluated on those components. Simply just to, whether it's the university's ranking, whether it is your appraisal system, etc., that's not being recognized. So even though we can talk about it with the bigwigs, and they recognize that it's a good thing to do when it comes down to going through those usual HR hurdles and so on, it's not being recognized. So it usually starts off as an initiative, but it usually fails as being sustainable because you have to re-navigate your energies elsewhere in order to keep your core function, your job from going. So I think we've got to move that conversation, but I think at the moment there are a lot of hurdles around that. And just one quick point, I guess, on the regulation aspect of it. I think there's really good conversation that needs to be had in that integration component, because we do have already established courses which have professional recognition. So I don't think we have to start by having necessarily a whole new set of criteria and courses. That perhaps we just need to stick people in a room and lock the door and ask them to speak across their disciplines in coming up with something that builds on what they've already got to support a more integrated framework for disaster governance, let's say, if I avoid the word management.
David, if I might, as you go to the Q&A, if I might just postulate on an alternative near pass that could have happened potentially, but didn't, for all the trillions that we've spent in our different countries as the pandemic over the last 2 years has spread. I think one of the challenges, our different sectors, our societies, our institutions are designed to operate incrementally. We sort of have that natural inertia, and as we were talking about earlier, our crisis management systems are designed to get us through today and into tomorrow, as opposed to looking at an event that might take place over months or years. So let's take an alternative spend, the sort of had those billions and trillions been spent on doubling the capacity of the health system, whether it be the NHS or the hospitals in the US, which are mostly private. But when we gave in the United States lots of money to hospital systems that were mainly used by some equipment, but really to sort of balance their bottom lines. But had we said with that, you're going to double your capacity for surge to deal with this and put that in place. And had we in the colleges and universities said, we now need you to train 20,000, 30,000 more nurses and respiratory techs and all the folks that support the medical system. The way we would have in World War II on a war fighting, and this has sort of been a bio war, you could look at it through that lens. We might be in a very different place here 2 years in without seeing the need and the discussion of lockdowns to save systems and the shortages of staffing. But we don't have a process in place to look past that day-to-day inertia, that incrementalism, and to impose that sort of unilateral system. At least we don't have that in the United States and haven't had it probably since World War II. The ability to think that, okay, this is a pandemic that's learned from the past. It's going to be a 2 to 3 year effort, and we need to put in place these sort of drastic incentives or measures to prepare. And just imagine if we had done that in our countries, where we might be if you had permanently used that funding to make permanent increases in surge capacity, how much more better prepared we would be for the localized disasters and other things to come. But we don't think that way. We don't think of how we can use the crisis to benefit the system. And so I think that's a challenge for us in education. It's a challenge for us in government. It's a challenge for us, again, to think how do we begin to think that way and develop crisis managers who can influence the elected officials and the private sector leaders to think about the ways that these crises can help shape the institutions to build more resilience and buy down risk for the next one.
I was just reading a paper by an American general, which I need to look it up. I can't remember who it was, but he says basically, if we imagine coronavirus, COVID-19, as a weapon of mass destruction, but without the military side, imagine how we would have responded. You know, we would have immediately put everybody together, single focus, put all the budgets together, sort it out. And yet, in the UK, we have never seen that. You know, there's this incredible amount of money, I think £400 billion pounds so far. If we'd taken that and used that in a structured manner to basically rebuild this country, as you've suggested, we could have had massive impacts and built for the future, which we haven't done, unfortunately. I'm going to come to questions. Grant, very good to see you, Grant, as always. Thanks for coming on again in Israel. Wouldn't it also be productive to develop a professional body that conducts disaster site investigations on an international level and build a knowledge gathering structure similar to the body that investigates airplane disasters and near disasters? And of course, the thing about it is that we don't have that on an international basis. But every time we have one of these events, whatever it is, a crisis event, Hurricane Katrina or 9/11 or Fukushima or BP Deepwater Horizon or Columbia or, you know, or Challenger or whatever it might be, there's a review. And we do this on our academic programs, Jeff, but and all of you actually. But what we do is we take those reports, the executive summaries, and we anonymize them. We say, which one does it belong to? And you can't tell because the executive summaries are all exactly the same, exactly. That you weren't paying attention, you ignored it, lack of leadership, lack of preparation, the plans you had didn't work, lack of communication, lack of agility, inability to create, coalition. You want to spend another 3 years having another review? We'll write it to this afternoon, right now, exactly the same. One of the phrases that I think came out of Hurricane Katrina was, you can't respond to a Category 5 incident with a Category 3 toolkit. You need to have the right kit. One of the phrases that has come out of COVID is lessons identified is not the same as lessons learned, because the lessons we're going to learn from the review into COVID are exactly the same as the lessons we've learned from every other bloody thing we went through over the last 25, 30, 40, 50 years. I mean, seriously. So we've learned the lessons. It's not that we don't know. It's that for some reason, as Nadine says, we just are not able to be grown up enough to say, we have to do something about it. And of course, we will not until it hits us personally. People don't wear masks until it hits them personally. Countries don't deal with climate change until it hits them personally. I think we need to slightly shortcut that. Alistair, what do you think about, again, going back to probably this overarching question of creating this body of knowledge, this integrated body of knowledge, just like architects all over the world have a body of knowledge. People who build planes all over the world have a body of knowledge. People who do human resources have a body, they have a body of knowledge. We don't have a body of knowledge. Are we any further forward? I mean, we're going to discuss it in 20 years' time. If we're still around, are we going to be saying, you know what, we really, really need to have a body of knowledge? Look at this. There's a recording of the ISRM conference on the 1st of December, 2021, 25 years ago. And what did they say? We need a body of knowledge. Are we going to be any further forward?
Well, I think we already do have a body of knowledge. It's just disparate. And it's usually based on personal or community experiences, as you mentioned before, in terms of when you're at the coalface, right, of a disaster, then that's when you'll either have community knowledge production. So you'll have stories and so on that people recount from when they personally experienced it. You'll have it in terms of how they work together in order to relieve the situation. We also have it in terms of universities and their own roles in that, right? It's just we've got it, because it covers such a broad area, and we're looking at a crisis, so just a very large shock, that it's going to be drawing on tools from a lot of different disciplines. So I think we don't have a central repository of knowledge, but we do have a network of knowledge, and we just have to be able to activate that network of knowledge. So I think I would say that. And unless we do that, and that means we're going to have to be doing, and we do have a couple of tools, and I'm not going to give new technologies too much of a shout out here, because I think there's also a lot of ethical implications over the use of them. But there are tools that we can be using as well to draw on different language experiences and so on. So I think there's already quite a lot of knowledge. We just need to activate it.
Yeah, I agree. I mean, like they said, in 1973, 77, 45 years ago, they were saying it was overwhelming, that the amount of knowledge and research was overwhelming. And that's still where we are. Nadine?
Yes, I'm coming back to the thought of having an international body that's conducting post-disaster assessments. And I quite like the idea, and I think it would be very useful to have such a body of knowledge, even though I do agree there are probably some challenges in relation to the implementation and sort of international acceptance of such a body. But I think one of the issues really, and you said, well, every executive summary reads the same. And that's quite worrying. But what's also worrying is that I'm not quite sure whether the methodologies by which those lessons have been derived, or data has been derived about the different disasters, how they actually have been designed and how they have been implemented. So by having an international body, what we might end up with is a common methodology in conducting post-disaster assessments. I mean, we all understand the sort of questions that need to be asked, but how they are then implemented and interpreted by different agencies in different locations in different parts of the world, that may well be a different question. So I'm kind of, and it's really interesting, it's a conversation that, or basically the discussion that Alistair has led earlier about disaster management and the difficulties of actually having a directive to teach it in a particular way, or to get institutions to act in a particular way. Maybe we need to think about this debate in a similar way as the sustainability debate has been conceived and also has been led in the past few decades, because we're looking at past few decades ago. Sustainability meant a lot of things to a lot of people. It still does. But it wasn't something that organizations felt particularly wedded to. They didn't feel a responsibility to act in ways that are sustainable, or to think about the triple bottom line. Whereas now we are in a very, very different ballgame. And I'm wondering whether this is a debate that we need to sort of approach in a similar way, where we're thinking, okay, so what does disaster resilience actually mean? What does this mean for those who are acting in the profession, but also for those who are not in that group of professions? Somebody who's a general manager, somebody who's working in agriculture. What does disaster resilience mean for them? And it's almost like we have to separate those two debates. But what the reason why I'm talking about the sustainability debate is because what we have now, what is called the Global Reporting Initiative, which is trying to bring sustainability reporting together, and is trying to bring it, to give it structure so that there is an international benchmark that can lead to comparisons as to how different industries are doing, how different countries are doing in terms of managing the triple bottom line. And I'm not quite sure, I mean, this is, we are at the beginning of the conversation, but maybe an international body would be a good thing. So somebody who is thinking about standards, thinking about methodologies for post-assessments, methodologies for developing disaster resilience frameworks, so such as what we are having in Build. So yeah, I don't know. So that's my thinking on that particular one. Back to you.
You see, my feeling is I'm not worried about that. We've got enough methodologies. I mean, we have so many policies, ISOs, My feeling is, we need to get down and do it. I mean, it is just, at some stage, we have those in place. My feeling is we don't have any shortage of methodologies, reports, policies, protocols, frameworks, etc., etc. It's just how do we get some impact? How do we get some impact and influence on the ground?
Yeah, David, I don't think I wouldn't say that there's a shortage of methodologies. This is not what I was saying, or protocols. I think there is quite a multiplicity, but this leads to a fragmentation of the data that's available. I think what we need is consolidation. I think that's my argument here.
I mean, I know, for example, this Kiyoshi Kurokawa report into Fukushima 2011, again available in English, and the executive summary says, this is one of the greatest disasters we've had in, says this was a man-made disaster. The problem was not a tectonic plate underwater earthquake, and it wasn't a tsunami. Those were events. The disaster was the people responsible for creating safety in the nuclear industry in Japan had broken every rule going for the last 30 years, just like they did with Boeing and with all of the other, or with Challenger and with Columbia, etc., etc. 3 Mile Island. Sometimes we know what we need to do. There's a word we haven't used yet. I don't know if we use the word culture, but it is a culture. If you look at high reliability organizations, it is the culture of acceptance of responsibility that's the issue. It's not just the technical stuff, but it's the culture of acceptance of responsibility. And I think we still see too much of our organizations sort of swerving around to get around that. Okay, we have 10 minutes left. Let's just go around the table. If everybody would like to do a sort of summation. Jeff, let's start with you, and then we'll bring it all together.
It's just such a huge, as you said, elephant of a discussion and so many angles to get to it. We've actually been debating for the last few years in the United States the need for sort of a national disaster analog to our National Transportation Safety Board, which is the very professional group that for decades would go and investigate when there's an aircraft crash or mishap, and does a very detailed professional set of forensics with lessons that go into the aviation industry. And it's even gone so far as to be proposed in Congress, but hasn't yet gotten there. I do think focusing on my role and where I think we need to shape at FEMA and at the Emergency Management Institute our role in helping develop our emergency management professionals to face and deal with a lot of these complexities and a lot of these issues we discussed for now and into the future. We're launching, we hope to launch, we'll see if the president's budget supports it, but we've been talking to a lot of our stakeholders, educating them. A new plan, a transformation plan we're calling EMI Anywhere, the idea that our training and education needs to be available to any emergency manager anywhere they are, anytime in their careers, as opposed to just focusing on our campus programs or online. Things need to be multiplicity, and we have sort of 6 initiatives related to this. First is to build a true modern e-campus, because some of our online systems are, as a lot of U.S. federal tech is, antiquated and not up to speed with a sort of modern e-campus or the process to do the delivery. Second, beyond our single campus in Emmitsburg, we want to build satellite campuses, Camp I perhaps, all over the United States in partnership with other universities and other federal partners, so that the programs, the in-person programs, have more seats and are more accessible. And in doing so, thirdly, to revise that 360 curriculum so it's very easy to understand if you're new to the field, what are the foundational courses and training and education you need to take, and what are more advanced, mid and advanced professional tracks, and in the advanced tracks, putting in new curricula that fills what I see as knowledge gaps in our body of knowledge for the practitioners, and even some of the non-emergency management communities. So we're looking at, for example, disaster logistics and supply chain management. It's a body of knowledge that actually there's no formalized training for. We steal it from other fields, but we haven't formalized it for U.S. disaster managers. Again, data analytics across the whole cycle, and how a local emergency manager perhaps can use that to inform and make their programs more resilient, more effective, where to spend the next marginal dollar. We're developing, fourthly, a executive crisis leadership program loosely modeled after what some of our U.S. military admirals and generals go through, because in our US federal system, we actually don't have a program where federal, state, local, tribal, territorial, private, and nonprofit leaders, actually the folks operating the system, come together to understand crisis theory, learn about it, learn about crisis decision-making, network amongst themselves. And we just expect the system to work sort of magically. And so we see that that's our role, as we can convene that. We do want to be a catalyst for bringing the academics, the educators, the researchers, the practitioners, the policymakers together to debate law and strategy through institutional processes, to build a joint research agenda, as opposed to a research agenda that the researchers think up or the policy practitioners think up, divorced from each other. And then sort of begin to put the profession in a mode of driving thought leadership. And then lastly, to put it all in context, we hope to evolve ourselves to build on that great 40-year tradition of training that we've done, but sort of back to the future, build back some of that education piece by reframing ourselves as America's National Emergency Management College. So we've got a long road ahead. It's currently being debated in the budget and the policy spaces, but we put some plans in place to implement that. That's sort of a lot of the how and the what that I hope will bring a lot of the interdisciplinary folks to the table, advance the really good technical training we have so that folks can get that education and that experience and can understand how to sit in that C-suite, as you say, how to come in and value add what we bring to the table with the either private or public sector leaders, so that they are there in the room and kind of sort of put the storyline, explain the complex data in a non-jargony way that offers pros and cons for political leadership to make decisions. I think we are not there yet, but I'm hoping we'll get there through a bunch of these activities.
Thank you for that. Well, I hope so. Maybe we can share some of the journey together. I look forward to seeing that, Jeff. Good luck with that. Nadine, let's come to you. Final thoughts and summation.
Yes, just a few short comments from me. First of all, thank you, Alistair and Jeff, for your insights. It was very, very, very interesting to hear from you, and I think I've learned incredibly much from this session, and particularly when it comes to thinking about the next stages in our project, because Jeff, you've just mentioned the sort of what do we bring to the table. David, you've talked about this as well. What do we bring to the table when we talk to policymakers, when we talk to businesses, when we talk to NGOs? I mean, for us, we have done part of that. We have gone through a consultation exercise where we thought about the end users of the centers of excellence that we are creating. I think we probably need to do more. We need to do more of it to make sure that the activities, the services that the centers are offering, that they really are fit for purpose, and that they are bringing different stakeholders together. And I think for me, the next big challenge, and this discussion has been incredibly inspiring and informing this next challenge, and also the next stage, and what we're going to do is to really think about how we're going to design a center, how we're going to design that multi-stakeholder integration into those centers of excellence, and also into the disaster resilience network that we are creating. How are we designing this in so that it's not just a matter of consultation at the beginning, but that this is going to be an ongoing exercise? So how do we make sure that our curricula remain dynamic, that research remains dynamic, that our community engagement remains dynamic, and that there is that there are synergies between those different streams. So it's been really, really interesting, and has certainly given me a lot of food for thought.
Well, that's good. We're glad that we've achieved our aims then. Fantastic. And thank you for your contribution as well, Nadine. I mean, excellent. Alistair, final words.
Thanks. Yeah, just a couple. Thanks to both the panelists, Nadine and Jeff, and yourself as well as chair for some really insightful comments and interventions. It's provoked a lot of things in my mind, and one of them is again another project. Again, as an academic, I guess we're all doing projects. But the collaborative nature that we've embarked upon at the moment just made me really think about how bringing together the policy, practice, and research, I think Jeff put all those three components, is again going back to making sure we understand what everybody's core mandate is, and how we can speak to those core mandates. So when we've been looking at the overlaps between natural hazards and the pandemic and so on, we've had to really look at how they are intersecting. And so looking at how we can integrate those by having, and from that conversation comes out a common lexicon, comes out a way of working together. So just building on that. But I think it's a slow process. However, I do have hope. I hope we don't go the sustainability route, because otherwise maybe it will be sustainability or disaster governance 27 years later, we've agreed on the methodology and we perhaps aren't where we should be. So I think we can probably skip a generation of what they've achieved in sustainability now, and have a more integrated, whether we refer to it as disaster governance or security, risk, crisis, etc., but definitely a more integrated approach as possible. And we've got the tools, as you've mentioned, to do it. So I think we just need to identify those partners in the different components of the structure to be the catalyst to make it all come together.
Well, thank you for that, Alistair. That was a great summing up for the summation of the summation. And of course, if you're talking about collaboration, mutual support in networks, the ISRM absolutely does believe in that. And thank you to you all. You are part of our networks. We've worked with all of you. Look forward to working with you in the future. My feeling is that there is a coalescing, there is a coming together. There's a recognition on multiple levels of the value of collaboration, not because it's a good thing to do as a word, but it just makes life better, it makes the world better, allows us to do more things, allows us to benefit from the work that everybody else is doing around these issues. And if we bring that back to the core overarching title or theme of this conference, which is global urban resilience, these are big problems, and they need people who really understand and have a conceptualization of the complexity and the issues and the interdependencies and all of those other things. And if that's not the academics, I'm not sure who it is. And we just got to make sure that that what we have has utility within that conversation. And hopefully this conversation has been part of it. We like to believe that these conversations have significance and relevance, both within our own spheres and for a wider audience. Thank you to our panelists. Thank you to Alistair Cook from Singapore, Rajaratnam School of International Studies, Nadine from the UK, from the University of Gloucestershire and Erasmus Build, Jeff Stone from FEMA Academy and Georgetown University. Thank you for your time today. Thank you for your efforts over many, many years. Thank you to our audience. And we will be back tomorrow. For the last session tomorrow will be a community engagement. We have a fantastic panel. We have Sitha Patel coming in from India. We have the head of International Federation of Red Cross, Shelter. We have Wing coming in from Indonesia on his work over there. We have somebody else, I can't remember. How terrible. We do have another person as well. So apologies for that. It's been a long day. Thank you to everybody. Stay safe. Look after yourselves. Please do keep in touch with us. And all being well, we'll see you tomorrow. Thank you to everybody. All the best.